Hello and welcome to this lecture on mobile applications in healthcare. My name is Daniel and together we will go through a couple of slides addressing this topic. First of all, there are many different ways of referring to applications in the literature. This is important to be aware of if you want to gain insight into this topic or when discussing it with colleagues in relation to your clinical practice. Some of the ways of referring to mobile applications are health monitoring applications, mobile applications, mHealth, mobile app, healthcare app, and mobile health applications. Mobile applications can be part of many different reasons for approaching either healthy people or patients. Some of these reasons can be from a preventive perspective, in relation to examination, treatment, and follow-up on patients. From a healthcare perspective, a mobile application can have several purposes. It is always important to specify the purpose when you incorporate a mobile application into your clinical practice. Some of these purposes could be measurement, monitoring, communication with patients, self-management purposes, goal setting, or information seeking. For example, monitoring could be used to monitor fluctuations in pain in patients. Or you can work with goal setting together with your patient to increase adherence. Also, self-management is often used in relation to pain across different patient populations. Let's try to look at a couple of examples. The examples I want to show you span across different healthcare professionals, different patient groups, and the mobile applications are put into use in clinical practice with different purposes. The first one is within a physiotherapist context, aimed at a population group which suffers from low back pain. The main purpose of applying mobile applications within this patient group would be towards managing the self-management of the patient. Another example could be within a midwifery context, where we have a patient group which suffers from pelvic pain. And in this case, the mobile application was part of the treatment aimed at reducing the pelvic pain experienced by this group of women. Also, mobile applications can be found within nursing. In this case, it's with a post-operative patient group across different operational procedures, and the purpose of the mobile application was to monitor the symptoms that they experienced. Lastly, in a medical doctor practice, working with patients with cancer, where mobile applications also were used to monitor symptoms. And in this case, the monitoring exceeded the pain experienced by patients and also monitored other symptoms relevant to this patient group. But before we ourselves work with mobile applications, there are a couple of basic requirements that we should be aware of. So, the very basic requirements that you need to be aware of when you want to use mobile applications in your clinical practice is that your patient must have a mobile phone. This is referred to as the hardware. Secondly, comes the software. The software is the actual application, and one doesn't go without the other. Fortunately, more and more people own a mobile phone, and as long as the mobile phone is compatible with application technology, it can be used. There has also been seen a steady increase in healthcare-related applications, so it's very possible that you are able to identify and retrieve an application which serve the purpose that you need to work with within your clinical practice. So applications in clinical practice should be straightforward, right? Most of the patients have a mobile phone, and if we are able to identify a mobile application which fit our healthcare purpose, it could be monitoring or communication, then we would automatically improve the quality of care by using the mobile application to support either the monitoring or the communication with the patient. Of course, it is not that simple, and therefore 2 + 2 doesn't always equal 4. Please, you should ask yourself, can we assume that because the availability of mobile phones and mobile applications has increased, then the ability of our patients to use this digital technology has also increased? Tech2Match work with matching the technology to our patients, and this requires both critical and reflective thinking.